Yes, so good afternoon, everybody. So what I'm going to do is, over the next half an hour or so, share my views on what we should be doing in the country and on organ donation. So the outline of my talk is something like this. We'll talk about the need for organ donation in the country, the concept of brain death and how organs are taken with brain death, what is the law on the subject, how do we proceed with organ donation in a hospital, where are the loopholes in the country right now in the program, what has been done so far, and what we can do at the level of our country, at the state level, city level, and at a hospital level. So this slide shows you the number of transplants we need in the country. And this is data from 2015, which I have borrowed from a slide. This is from Dr. Sunil Shroff and Noto. That if you see here, more than 4 lakh people need a transplant in our country in a year. And see the number of transplants done in 2015, only about 17,000. So what it shows us is that less than 5% of the people who need a transplant actually get one in our country, and the remaining continue to suffer or they just die. Now, what is the source of these organs? There are 3 potential sources. There's the living donor, which is from the near relatives. What we are here today is for donation in non-living donors, people who have to donate after a brain death. Growth of organs from stem cells is still in a very, very experimental stage, and we are several decades away from this. A few words on the concept of brain death. In brain death, the injury occurs to the brain so that the brain dies. The blood continues to circulate because the heart is beating for 1 day, 2 days, and that is the window in which we need to retrieve organs. It's important to understand that brain death is death, and nobody has ever come back after a brain death. So the only difference between brain death and death is that the heart is beating in a brain dead person, whereas in a normal death, the heart has also stopped. Now these are the 6 organs which we would normally transplant after organ retrieval in a brain dead person. We have the heart, lungs, liver, kidneys, small bowel, and pancreas. Since we have 2 lungs, 2 kidneys, and sometimes they do divide the liver into 2 and give the left lobe to a young baby, and therefore 1 organ donor can save up to 9 lives. Please do remember that organ donation is different from tissue donation. When we talk of donation of eyes, skin, bones, heart valves, this is something one can do in a conventional death also within about 6 to 8 hours. So this is tissue donation, but what we are here to talk about today is organ donation. Now there are various organizations that have been involved in organ donation in the country. It all started from the south of India, Chennai, and gradually it has made its way northwards. But I'm very happy to say that now what I'm showing you in red is the effort from the Government of India. NATO, the National Organ and Tissue Transplant Organization, has its headquarters in New Delhi, and it has already started functioning. And as you can see, there are regional autos all over the country to promote this cause. So now we are ready as a country to really make good progress. And progress we have made in the last 5 years. If you see here, our organ donation rate has climbed from 0.05 per million population in 2010 to 0.5 per million population in 2015. So we've had a 10-fold rise in organ donations, and this is when the government system was still not established. So we can now expect much more. But still we are a far cry from the rest of the world. If you see here, Spain, Croatia are in the range of 35 to 36 donors per million population, and we are still at 0.5. So a long way to go for us. And look at this dichotomy. We have the largest number of road accident deaths in the world and one of the lowest organ donor rates. So this is what gap we need to close. We need to reduce our road accidents, but at the same time, if the patient doesn't survive, we need to increase our organ donations. So here is a slide which shows us how many donations happened in the country in 2015. If you see here on the left lower corner, we had 570 donors donating all their organs all over the country. Tamil Nadu, as usual, has been leading in this, but we have got some very good scores coming up from Kerala, Maharashtra, Telangana, Andhra Pradesh, Karnataka, Gujarat. Chandigarh, as you can see, has made a good mark in North India with 39 donations, whereas the NCR can do much better, only 14 donations. And if you see the right lower corner, 1,675 organs have been transplanted across the country. Now mind you, 10 to 15 years ago, there was no such slide or no such figure, so we have made a pretty decent beginning. Now how do we increase the organ donation in the country? I think we need to divide this into three. What is the role of the government? What is the role of us in the medical community, which is most important? And of course, how do we increase the public awareness? So it's very important to note that organ donation doesn't happen on its own. Somebody has to feel the need for it. Once you have the felt need, we put systems in place, resolve the issues which occur all around it, declare brain dead, counsel the families, make systems, and then only we have organ donation. So it all starts with a felt need. And I was very happy to hear the Prime Minister talk about organ donation in Mann Ki Baat. And I think when the Prime Minister of the country wants to push this program, it's really wonderful for us. We now, as I said, have the NOTO and ROTO in place, which already a good amount of work has been done in 1 year. We have a donor registry in place in NOTO. Prospective recipient waiting list, blood group wise, is now becoming more, it's getting more robust. We have a technical committee that makes the guidelines on sharing organs, and most of them have been completed. And of course, we have now earmarked 27th November as the National Organ Donation Day for the country. Very importantly, we have the Transplantation of Human Organs and Tissues Rules of 2014, and this is a real game changer as far as organ donation is concerned in the country. And this slide shows you how in 20 years our rules have become more user-friendly for organ and tissue donation. Earlier, brain death declaration was allowed only in hospitals which were registered for organ transplantation. But now, in 2014, any hospital which has an ICU, one can declare brain dead. Earlier, neurophysician or neurosurgeon was mandatory in declaration of brain death, one of the 4 doctors which are required. But now, if there is no neurologist or neurosurgeon available, the other doctor, like a physician or an anesthesiologist, can also declare, but the team of 4 doctors is still required. Counseling for organ donation was not mandatory, but now it is mandatory that every time there is a brain death, the family be counseled about organ donation. Transplant coordinators are now mandatory in every hospital which is transplanting, and in medical legal donations, the procedure has been simplified and the post-mortem, etc. is much easier. Let me tell you a little bit about the data that we have done in North India. This is the first study that we had that we published in 2009, and I would very proud to show you that these are the 6 soldiers that we had transplanted. They got a new liver way back in 2007, and mind you, they were all dying of cirrhosis, and they got livers from people after brain death, And as you can see here, they not only their lives were saved, but you can see they wore their uniform and they were back on active duty. So that is how good a transplant can be. We have had people who have played football for Barcelona as a liver transplant recipient. We've had bronze medalists in Olympics. So the quality of life can be really amazing after organ transplant. And this is the data which I wanted to show you. It's very important. Out of 2,000 odd ICU admissions and 700 odd patients on ventilator, we could diagnose brain death in 40 of them. And if you see the right lower corner, very important that in about 30% of the patients who had brain death, who died after a neurological problem, we were able to diagnose brain death. What I'm trying to say is that if you have a patient with a head injury or a stroke who dies, 30% of the time you can pick up that there is brain death before the heart stops, provided you're looking at it prospectively. Our Fortis organ retrieval and transplant was established in 2012, and with the idea of promoting organ donation after brain death in our hospitals. We made an SOP which is being followed in all the hospitals, and as you can see, we have a pledging facility also available online. So these are the 16 hospitals all across the country where we started the SOP and were actively promoting organ donation. We did workshops in quite a few of these hospitals, and these are the figures we have till date. We've had 37 donations across the country in Fortis hospitals, and 111 patients have received a transplant from organs generated within our own system. I would like to share with you the data from my own hospital where we have a team tracking brain deaths and organ donations at all times. And this is what is representative of what we can expect in the country and also the problems that one can expect. So out of 27 brainstem deaths, we could counsel 22 because 5 were excluded because of infections or malignancy. 7 of the families agreed for donation, which came to 30% consent rate. But even after the family accepts, we could not carry out a donation in 2 because in 1, we did not get a consent of the police, and in 2nd, the heart stopped before the organs could be retrieved. So let me just address all the issues that can occur, and let's take them up one by one. This is the way a flow chart happens in a hospital on organ donation. Once there is a patient with a head injury or a stroke identified by the critical care team, and they find that the patient may be brain dead, they apply some exclusion criteria. They rule out malignancies, sepsis, etc. And then they do a preliminary testing for brain death. If this patient, the treating team feels this brain dead, then they inform the administration, and then the first set of tests for brain death, the formal set with 4 doctors, is carried out. But this is where we are failing as a country. We are not identifying patients with brain death in our ICUs. It is felt world over that there should be at least 1 brain death per ICU bed per year in every city. So if in Delhi we have, say, 1,000 ICU beds, we should be identifying at least 1,000 brain deaths in a year, whereas we are identifying only 50. So we are grossly wrong in this, and we need to do much better. The tests for brainstem death are very simple, and they do not require any cost or fancy equipment. They're all clinical tests. We look at all the cranial nerves as shown here. And then the final test that we have in our country is called the apnea test. And since majority of people who are watching this transmission are doctors, I would like to describe the apnea test to you. So what we do, the principle is very simple, that in a patient who is on ventilator with fixed dilated pupils and we feel that this patient may be brain dead, we disconnect the ventilator after doing a baseline ABG and we put an oxygen cannula close to the carina and continuously give oxygen. So what happens if the patient is brain dead, there is no ventilatory drive, and the carbon dioxide begins to accumulate in the body. So after about 8 to 10 minutes, we repeat an ABG, and if we find that despite the PaCO2 going above 50 or 20 above baseline, there is no ventilatory movement, we know that this patient is brain dead. So this is the test which is done at the bedside to confirm brain death. Getting on to the next step, the first set of tests for brain death, this is done by the team of 4 doctors, as I've already described. But let me tell you a story of what actually happens in our hospitals day to day in the country. Now this is my own mother-in-law, whom we ended up donating her organs a couple of years ago. She was admitted with a large intracranial hemorrhage in one of the leading hospitals in New Delhi. And then I knew that she was possibly brain dead, but when you talk to the treating team, they will always say that she's maybe 95% brain dead. There's nobody willing to carry out the tests and confirm this on ground. There was no brain death committee in that hospital. So we had to shift her on ventilator to another hospital and take her organs. And I think this is where we need to really improve in the country. The need of the hour is we must declare all brain deaths. We must report all brain deaths and approach all the families. So unless there is a situation where we declare all deaths and approach all families, we are not going to improve in our numbers. Once the second set of tests is done after about 6 hours, the patient is declared dead, brain dead. And do remember that at that time, the death form is also filled. Then the consent of the donor of the family is taken and the organs are retrieved. Let's look at the next step. The next step is where we get stuck is the counseling. We do not have enough trained transplant coordinators in the country because the counseling for the family is a very, very complicated issue. It has to be done by experts, and the transplant coordinators are the right people to do that. And the transplant coordinators should come into play only when the treating team gives them the go-ahead. So the treating team should declare brain death. They should tell the family that their loved one is no more, even though the heart is beating, and then allow them to grieve. And then the transplant coordinator tells them that, listen, you have another chance of doing something for society. Would you like to donate? So this entire process doesn't happen 95% of the time in our country because we just shy away from declaring brain death. And we do our bit in training transplant coordinators. We are now doing it on our own. We do it with NATO, with Bohan Foundation, and already 170 people we have trained across the country. And every April we have a workshop. So if anybody wants to send their coordinators for training, this is a NATO certified course that we do in every April for about 60 to 70 people. And now another very important stumbling block is the family saying no to donation. And I think for this we have to work on awareness. And the biggest stumbling block is this. Now this is a monitor of a patient who is brain dead, and you can see that the heart is still beating. So what the family says is, Doctor साहब, आप क्या कह रहे हैं? आप कह रहे हैं कि इस दुनिया में नहीं रहे हैं पर उनका heart तो beat हो रहा है. So that concept we have to work on right from school days onwards to get into the entire community. And I'm proud to say that we now have an association with the NDTV, and you will be watching a lot of celebrities and a lot of activity on increasing awareness on organ donation. We have approached all the religious leaders, and all of them are very clear that there is no religion in the country which stops us from donating. But I feel we need to go a step further. Instead of a religion saying that no, everybody is okay with the organ donation, we need to come forward. We need to take the mic and announce that yes, our religion is all right. We need to proactively say that organ donation is okay with our religion. The last step where we get stuck is when the family says yes and still we cannot, because sometimes the police clearance takes time and by then the organs go bad. So the there are two things very important in this. One, as the brain death continues, the quality of organs gradually goes down. So while we are talking to the family and waiting for the clearances, etc., the donor maintenance must start. And this is the critical care team which takes care of the fluid, electrolyte, and so many hormones, etc., to keep the donor and the organs healthy till the decisions are taken. And with donor maintenance, you can see that the quality of organs can be maintained or even improved prior to organ retrieval. And donor maintenance is no big deal. You actually just need a central line, manage the fluid, electrolytes, continue antibiotics. We try to use vasopressin as a preferred vasopressor, and we give methylprednisolone to all our patients. So this is exactly what donor maintenance is, and any critical care team should be able to do it. Now the important thing is who pays for the donor maintenance. So if the family says no to organ donation, we cease the donor maintenance. But if they are still thinking about it, and if they say yes to donation, we do continue the donor maintenance. But do remember that once a family consents for organ donation, we do not bill them anymore from that point onwards. And now NATO also has a provision where rupees 50,000 is paid by the government to a donor hospital for the costs incurred by them in organ donation. So donor optimization gives us time, and gives us time to also to get the recipients. The second important role of the police to understand is in medical legal donation. You can see a CT scan here where somebody got shot in the brain, and this happened in Meerut. The patient had come to Delhi, so there was a murder involved. There was Delhi police, there was UP police, but with 12 hours of hard work, our team was able to get the sanction for organ donation. So if you can do it in a murder victim, I think you should be able to do it in a normal road accident all the time. But the police has to be with us, not only for medical legal clearances, but also to make green corridors. So like we've done green corridors in Delhi for the first time, we did it in 2014, and similar green corridors, the police all across the country is helping us wonderfully in transporting organs. But green corridors is not the way forward, because we do tend to disrupt the public. Ultimately, like the developed world, we have to take the aerial route and use helicopters for transporting organs. So our aim, ladies and gentlemen, is to achieve an organ donation rate of about 2 per million. Remember, right now it is 0.5, 2 per million by 2020, and that is something which we are all striving for. So what we can do, once again, as a government, as a medical community, and for awareness, we've had our much needed push from the Prime Minister, but our states have not yet adopted all the law. You can see here that most of the transplant activities are happening in the states which are green in color, some activity in the yellows, but a lot of part of the country, they've not even adopted the Organ Transplant Act. So we need to make a move on that. So at the national level, we could include best practices in brain death in the accreditation process for hospitals. We need a really sustained media and a social media campaign by the government. We don't need organ donation weeks and days. We need round the year ongoing social media and media campaign by the government. As I said, we have spiritual and religious leaders who need to endorse actively, not passively, but actively about organ donation. And we must teach organ donation in schools, in MBBS, etc., etc. And very important, we must get all celebrities involved in organ donation to attract attention. We must make people pledge to donate when they apply for driving license, like they are doing now in Bangalore, like they are doing in Chandigarh. I think the whole country needs to do that. As far as donor families are concerned, there are a few things which we could consider as a nation. We could fund the last rites as a part of a Die a Hero campaign, provide discounts in Air India or train travel. You know, they could get a priority boarding pass, health insurance. There are hospitals like SMS Hospital in Jaipur, which has named wards after organ donors. We could have roads, etc., named after people like that. And at state level, we must adopt the Transplantation Act. We could earmark the key donation hospitals. Now, these are the hospitals which are already doing good work. We could acknowledge what they're doing and use their help in teaching others and to pursue the national agenda. At the city level, the police and post-mortem authorities need to be sensitized. We need a proper awareness drive around the year, and we have started publishing an obituary. Every time there's an organ donation, we publish an obituary from our side, from the hospital side, in the local newspaper to increase awareness. But obituaries are very costly, and I think the newspapers should do it at a very discounted price. Another way of increasing the donations is by making walls of tribute in the country. Now, in our own Fortis hospitals, as you can see here, we have made these walls of tribute, and these are the 37 donors from our hospitals, and this wall will remain forever. And every time a donation happens, we attach a star to this, and for the family, that is an amazing recognition. You know, it is like what we do for the soldiers. It is like a war memorial, and this is forever. So that is the way we could honor our donors. At the hospital level, organ donation doesn't happen on its own. Every hospital must earmark a key donation person who is responsible for it. And in some of our hospitals, we have organ donation committee, which goes around every day to see that if there is a brain death or not, and whether the administration knows about it or not. And of course, brain death committees, declare all approach, donor maintenance protocol, and a monthly return must go to the ROTO, SOTO, or the appropriate state authority. We must know how many potential organ donors we have in the country. We can do what we can do. Us doctors who are listening to all this, we must pledge to donate our organs. We must inquire in our hospital whether we have a brain death committee. And if our hospital doesn't do transplant, we can apply for a non-transplant organ retrieval center. And we must have a donor maintenance protocol so that the quality of organs is maintained. In the end, ladies and gentlemen, Spain has one of the best organ donation rates in the country. If they have a festival called the Castle in Spain, we have our own Dahi Handi. So if Spain can do it, even India should be able to do it. And I'll close by inviting all you listeners for this wonderful meeting that we are carrying out. It's a national summit on best practices in organ and tissue donation. It is happening on the 3rd of September in the Fortis Hospital in Gurgaon, and we are doing it along with the International Society for Organ Donation and Procurement, and their president is coming to talk on the world's best practices in organ donation. So with that, I will close my talk and invite questions. Thank you. So should I go ahead with the questions that have been coming?
Yes,
so I have
you may take the...
Yeah, I have one question coming up from Mr. Rajesh Banwal, and his question is, and in the light of the organ transplant doctors getting arrested in Mumbai, what do you think needs to be done urgently to keep the medical community enthusiastic in organ transplant surgeries? Yes, I think that is a very, very important question, especially in the light of what has happened in Mumbai recently. See, what we have to remember is that the doctors are there to treat patients. They are there to carry out life-saving surgeries and transplants. The documentation, whether it is proper or improper, is the responsibility of the authorization committee. Whether something has been is an original or it has been it's a counterfeit or something like that. So those things should not be doctors' problems. So definitely doctors need more support in all this rather than being accused of all this. Is there any other question? So we have a question from Rashmi Mavia. I don't know where she's from, but the question is, what is the cost of organ transplantation in India as compared to the West? Yes, that is an important question. As of now, the cost in India is, I would say, about 10 to 20 times less than that in the Western world. But even this cost is way out of reach from the common man. So we definitely need to address that issue. For example, a liver transplantation could cost you anything between 19 and 25 lakhs in the country, in the private sector. So a kidney transplant is about 5 to 6 lakhs. So there is a lot of scope for working on the costing in our country. And another problem we have is that organ transplantation is confined to 6 or 7 states in the whole country. And out of that also, 90% of the transplants are happening in the private sector. So the government sector needs to pick up the quality of the hospital, the quality of equipment, the quality of doctors. And I don't think that doing a kidney transplant in government hospitals should be such a big thing. And every state should have at least a kidney transplant program to start with. And I think the government is working towards this. We have now aims like institutions coming up all across the country, and that should help a lot. So I have a question from Vidhi Parik, and she says, I had my aunt who expired last month, and our family volunteered for organ donation, but doctors at Ahmedabad did not respond. How can we take steps as a citizen to help convince doctors to carry out these tests? So again, Vidhi, it is important to understand that I do not know what happened with your aunt, but if you have a normal death, you cannot do organ transplants, okay? There is something called DCD, which is called donation after circulatory death. But that is something which we are not doing much in our country because our laws are not permitted in our country. We are not permitted to withdraw support to anybody in the intensive care unit. So as of now, our organ donation is confined to patients with brain death. So I do not know if your aunt actually had a brain death or she had a cardiac death. And if there is no brain death, nobody will ask you about organ donation, but yes, you can donate the eyes and you can donate tissues like skin, like bones and heart valves. Steps as a citizen, I think it is up to the doctors and each hospital. As I said, unless the organization shows interest in organ donation, it doesn't happen on its own. So the doctors need to, the hospital administration needs to make sure that every time there is a brain death, the patient is declared brain dead, the donor is maintained, and the family approached for organ donation. So community-wise, yes, we need to increase awareness in schools, in colleges. We need everyone to know about organ donation. It's very difficult to understand the concept of brain death when you are grieving. You need to be talking about all this in a normal day-to-day conversation in schools and colleges. A family which is grieving, to expect them to understand that the heart is beating but their loved one is no more, that is a very tough ask. Rashmi again is, are there any policies that protect the donor's family from being exploited? Yes, I think as far as the donor family is concerned, it is a very, very altruistic act on their part. So there's no question of exploitation. So the moment somebody is brain dead and the family says yes to donation, whichever hospital they are in, the billing should cease from that time onwards. There should be no extra billing of any kind. And in fact, we go out of the way in our hospitals to look after the donor family. We make them comfortable in a nice room and they are looked after throughout the process and in fact through the last rites, etc., etc. So donor families are absolutely protected. There is no question of any exploitation. In fact, we need to honor all the donor families, and we are doing that by making a wall of tribute, etc. So there's a question from Ananya Das Gupta. If I opt to become an organ donor voluntarily, would you still require the family's consent for donation after brain death? Yes. Now that is a very important question, that what is the legality of a donor card that we are making? So we carry the organ donor card in our pocket, but if you see carefully, the card says that please keep your family informed about your wishes. So the donor card as such per se has no legal standing in our country. It is just an expression of a person that yes, I would like to do this if I have a brain death. Therefore, if the family is not informed during one's life, it is difficult for the family to understand. And it's important to talk about this when you are alive and in your day-to-day conversation, because ultimately the family has to say yes for donation, whether you have pledged to donate or not. What kind of educational or training program should be regularly organized to help intensive care specialists identify more brain death patients in ICU? That's a very important question from Rajesh Barnwal, and a very important one. So what is happening is what we have started doing is we identify people in the intensive care unit, the doctors, who are interested in this kind of activity, who would like to know more about organ donation, and we have a champions training program. So you can't train everybody in everything. So in our hospital, whenever we have a brain death or a brain death situation, we have the specialists who are actually trained and who like to work in this field who are brought on duty. And not only the specialists, we have a champions training where we train the intensive care specialists, where we talk to the nursing staff who are there. So all these people are trained in going forward and declaring brain death and talking to the family. So champion training for ICU doctors, for critical care staff, for nursing staff, transplant coordinators. So that is how it is. And this has to be done around the year. And I do expect that societies like the Intensive Care Society, etc. in the country, the Critical Care Society, they would have sessions on brain death, on how to declare brain death, on do a practical of apnea test, on donor maintenance, and all those things have to be done by the respective societies. Of course, the government also needs to chip in by having, as I said, if you have a key donation hospital, suppose there is a hospital in a city which is doing excellent work in organ donation, they need to have the recognition for it because it is a lot of hard work, and they are the ones, their services and their experts can be used to train the others. So the question from Rajan Chaudhary on how do you see ABO incompatible transplant easing the shortage of organ donors. Here we are talking about organ transplantation already being very expensive. So I think we should do more of organ swapping, where we have families who have a particular blood group, they can swap organs with each other and still continue to have a very affordable transplant. Yes, with a real back-to-the-wall situation, one can do ABO incompatible transplant, but then the cost goes up by at least 2 to 3 times. It's not for everyone. The medicine that we use for ABO incompatibility, etc., they are strong medicines, and you can expect more complications, more infections. So that was a nice stream of questions. Do we have any more? So how many of you who are still listening to me have actually pledged to donate your organs? So do ask yourself that should I do it myself or not? And you can go to the NATO website, you can go to the Fortis Healthcare website, and you can, with one click, pledge to donate your organs. That will be a nice thing to do. And that's another point we have in our country, that if we have 400,000 people who need an organ in a year, at least those 400,000 families should be pledging to feel the need for it. But even that doesn't happen. We've had a family who had a kidney failure, and they were trying to find a kidney recipient for their loved one, but then the same patient had a brain hemorrhage and the liver was good. We requested them for the liver, but then they did not agree. So all of us seem to want it very badly for ourselves, but when it comes to giving, we take half a step back. So it may not be a bad idea to make everybody should have a donor card, and the organs could possibly go to only those people who have pledged their own organs. Because everybody wants organs, but nobody is willing to give them. So we need to promote altruism in our country.